So good morning, my name is Jasmine Supeta from BSN 25 and I'm going to perform catheterization for both male and female and also the removal. So for the first step is check for the physician's order. Next is prepare the needed equipments, the syringe with sterile water, the cotton balls, the sterile gloves, the lubricants, the urine bag, the polycatheter French 14, micropore tape, and the urine specimen container. So, after that is greet the patient and inform her the procedure para mas makapag-cooperate yung patient sa atin. So, good morning ma'am. I'm your student nurse for today and I'm going to perform catheterization para po mas makaihi kayo ng maayos. Next is perform hand washing to prevent the transmission of microorganisms. And after hand washing is provide privacy for the patient. Next step is place the underpads under the buttocks and slide in place. So here is the underpads and position the client in a dorsal recumbent position with knees flexed. Spread the blanket over, leaving the genitals exposed for a better visualization. And then place the tray between the legs and position the light for a clearer view. Next is put on gloves. So next step is inflate the balloon to check if defective and then aspirate. So here is the polycatheter French 14 specifically used for the female. So nag-inflate yung balloon, so meaning hindi siya defective. And after that is aspirate. After that is using the non-dominant hand, pick up the cotton balls to clean the area. So separate the labia and pull slightly upward for a visible urinary meatus, and then pick up the cotton balls and clean the area. So clean downwards using one stroke and drop the cotton balls in the receptacle. So clean the labial folds until the anus, and then use new cotton balls after each stroke. So after that is lubricate the Foley catheter about 1 to 2 inches from the tip. So here's the lubricating jelly. So after lubricating, gently insert the catheter about 2 inches until the urine starts to flow. So if there is a resistance, instruct the client to take a deep breath and then rotate the catheter. So next is inflate the balloon again using sterile water. So to the injection port. And then so pull gently to feel the resistance. So dahil may resistance na, after that is obtain the urine specimen if ordered and then connect the catheter to the urine bag. And after this is check the flow of the urine. And then using the micropore tape, secure the catheter on the upper thigh of the patient. So after this is dries the area and place the urine specimen in a safe area and remove the tray and equipments from the bed. And then place the client in a comfortable position and measure the urine output. Note the character, the color, and the consistency. And then measure the urine output and send the specimen to the laboratory. And clean and discard the disposable articles. And lastly is document the procedure. So for the removal, empty the balloon using the barrel and then withdraw the fluid. And then next is pinch and gently pull the catheter from the point where it exits from the meatus. So you will feel a slight burning sensation from pulling the catheter. And then after this is make sure there are no remnants remain in the bladder, and if the catheter is not totally intact, report this and save for inspection. So empty the urine bag and measure the amount of urine and record in the intake and output sheet. And then after this is remove gloves and wash hands. So wash hands to prevent the transmission of microorganisms. And then discard the disposable articles and return the reusable articles. And record that the catheter was removed, the date, the time, and by whom, and also note the amount, color, and clarity of the urine. Document the patient teaching and the level of understanding, and assess the patient for 24 hours after the removal for the patterns of elimination. I-note also yung time and amount ng first voided urine, and lastly is document the procedure. So now let's proceed to the male catheterization. So the first step to do is to open the package catheter and inflate the balloon to check if defective, and then aspirate. And then after this, aspirate. And gently hold the penis at shaft and hold it at the right angle with using the non-dominant hand, and clean the urethral meatus in circular motion, working outwards from the meatus. And then use sterile forceps and new cotton balls with each stroke, and drop the cotton balls in the receptacle area. So after this is lubricate the catheter about 1 to 2 inches from the tip. And then hold the penis perpendicularly and pull slightly upwards on the shaft, and ask the patient to bear down slightly and slowly insert the catheter. And then advance the catheter about 17 to 22.5 centimeter or until the urine flows from the catheter. Then after this is inflate the balloon using the sterile water in the syringe. And then pull the catheter slightly to feel the resistance. So after that is obtain the urine specimen if ordered and connect the catheter to the urine bag. So, and then check the flow of the urine. So, after this is using the micropore tape, secure the catheter on the upper thigh of the patient. So after that is dries the area and place the urine specimen on the safe area and remove the tray and equipments away from the bed. Place the client in comfortable position and measure the urine output, the note, the character, and then the consistency. And then send the urine specimen on the laboratory. Clean and discard disposable articles. And lastly is document the procedure.